Yeah, so hello everyone. First of all, Colin, as always, is a real tough act to follow. So just giving myself a moment. But I think what I have to say will complement Colin's presentation really well. And what I'm about to speak to you about today is actually a project that Colin collaborated with me on. So yeah, it's quite special and meaningful. So I'm going to be talking about the psychological impacts of racism. Myself, I am a Black female trainee clinical psychologist, soon to be qualified. And I'm going to speak to you today about my doctoral thesis and some of the findings that have come out of that. And then I'm going to share some reflections at the end on my experience of being a Black woman in the system. So, first of all, just a note to terminology. So this is something that I deliberated about for a long time, in not even just in the early stages of my project, but right up until the end, in terms of how do we define race and how do we define those of us who are othered when it comes to our race and our ethnicity. And I know that there's a lot of controversy, particularly at the moment, around the term BME, terms which I myself do not subscribe to. But also we have people of colour, ethnic minority, all terms which I experience as quite derogatory, quite othering, and also I think it's difficult when you think of people like myself. Actually, we're members of the global majority, so actually quite neglectful of that. So I settled on the term racialised for my project, and I think that speaks to people who are non-white having our race ascribed to something that is much bigger than our skin color. So we have been racialized by power and by structures, and that in turn has denigrated us in society. So that's just a note to terminology. So my project is about racial trauma. So for my doctoral thesis, I explored psychologists' understanding of racial trauma and their experiences of addressing this with clients from Black and Asian racialized communities. And racial trauma is a term that, particularly in the past year, has kind of been floating around significantly more following the murder of George Floyd and the subsequent amplification of the Black Lives Matter movement. It's a concept that hasn't really gained much traction in the UK as of yet, but there are a number of theorists in the US that have kind of coined this term and researched it a lot more prolifically than we have over here. So if we're thinking about what racial trauma is, it essentially is an emotional injury that is motivated by hate or fear of a person or group of people as a result of their race. And the key thing behind racial trauma is it is a motivated stressor that overwhelms a person's capacity to cope. So what I'm talking about here are the psychological impacts of racism that make it a traumatic event for people. And this can be experienced in a number of different ways. So as well as racist life events, interpersonal events, we think about vicarious racist experiences. For example, and actually a very current example is what we as a Black community are currently feeling following the racist abuse of England football players following the final of the Euros on Sunday. That for me is an example of vicarious racism, and it's something that I'm currently feeling myself. Racism comes in the form of microaggressions, collective experiences of racism, and also transgenerational experiences of racism. If we're going right back to slavery, the impact of that is still seen today in the generations that have since come. So I won't pay too much attention to the next two slides, as they are statistics that can be researched, but I just wanted to give an understanding of why I'm interested, why this is important for me, and should be for everyone. So to pick out a few here, Black individuals are 5 times more likely to have force used against them by the police than white individuals. Racially motivated crimes accounted for 76% of hate crimes in the UK between 2018 and 2019. And at the time of the 2011 census, 3% of the UK population were Black, but Black individuals were more than twice as likely than white individuals to die in police custody, making up 8% of these deaths. So those are just a few, and this is by no means exhaustive, but this gives you an idea of where we're currently at in the UK. And within mental health services, Black individuals are 4 times more likely to be detained under the Mental Health Act than white individuals, more likely to be diagnosed with schizophrenia, even when displaying similar symptoms to their white counterparts. And mental health services within the UK are largely based on Eurocentric paradigms and worldviews, so speaking there to Colin's earlier points as well. So this is just a little understanding of how racial trauma kind of comes about within the field of psychology. So at the moment, psychological trauma is most commonly understood in terms of diagnostic criteria for PTSD as actual or threatened death, serious injury, or sexual violence. But we know that there are higher prevalence rates of PTSD in Black and Asian racialized communities, and this is consistent when accounting for other relevant factors as well, such as socioeconomic status. So there seems to be something there that that affects racialized communities when it comes to trauma that is different to white communities, and that's what I'm interested in. This model, there's a lot going on here, but the main thing that I would like to highlight is the bottom here, so reaction, signs, and symptom cluster, and that is the impact of racism. So when we're thinking about flashbacks and nightmares, memory loss, inability to concentrate, hyperactive, depression, poor relationships, withdrawal, guilt, these are all symptoms when it comes to mental health diagnosis that are associated with trauma, but racism can and does evoke these same symptoms, but is not considered. So moving on to my study. So I recruited within North East London Foundation Trust. And I recruited 13 qualified clinical and counselling psychologists that were working across community and inpatient services. I had 11 female and 2 male participants. 8 of these identified as white, 3 as Asian, and 2 as Black. So I'm just going to briefly take you through my themes here. So I had 5 main themes in my study. So I interviewed the psychologists, as I said, about their understanding of racial trauma and their experiences of attending to this with service users, as they are termed in the mental health system, with from Black and Asian racialized communities. So my first theme was around navigating racial trauma as new territory. And this really speaks to the idea that really for psychologists, racial trauma is not something that they are trained and accustomed to addressing. So first sub-theme here, where is racial trauma in psychological assessment and formulation guidelines? So Darren here said, there is no diagnostic label that you can put on your RIO, homepage that gets you a certain treatment route for racial trauma. I mean, that's not really a term we use at work, I would say. So I think people probably would talk about it as trauma general, and then the context would be racial or otherwise on the basis of experiences that happen to feature. So I don't think it's ever talked about in the setting I work in anyway, as a particular type of trauma necessarily. And the second sub-theme here is the accumulation of racism leaves us feeling helpless and hopeless. And this seemed to speak to the idea that psychologists felt disempowered themselves to address racism, as they thought that it was something that they wouldn't be able to help their clients with. They saw it as something that was as a wider systemic issue. They wondered what contribution they themselves as individual clinicians would be able to make. So Mabel says here, I'm thinking specifically about a case we had recently of a young Black man who was sectioned by the police, which is absolutely not what the team had wanted to happen. And his mum was devastated that it had happened. And it just, when we were talking about it as a team, it just felt like there was this sense almost like of hopelessness, of like, what is going to change? How do we change this? And I wonder again if that sometimes just like almost puts the fire out of people wanting to think about these kinds of things. So my second theme here is about bearing witness. And this seemed to be the idea that for psychologists, even giving a space to racism within their clinical practice seemed to be a way that they were able to actually acknowledge that this was a real lived experience for the clients they were working with. So I had 4 sub-themes here. The first one around speaking up, and this that sub-theme kind of encapsulates the idea of speaking up within the multidisciplinary team that psychologists worked within. So Fiona says, I suppose I felt like it was such a serious thing to say and that very little people are racist, like, as in, because you were going to be, I was going to be saying to somebody, just say you're the consultant, like, I get the sense that this is coming from a perception that you have about this young woman because of the color of her skin, like. So like that would be deemed me calling him racist, and I could get in trouble for that. The second sub-theme, when you know better, you try to do better. Paola said, this is something that you might not get right. So it's important that you know it's still good to try and not be too scared not to try anything. But that you might say something that's unhelpful to people as well. And I think I've had less awareness of that thinking because I was a nice person, everything will be okay. The next sub-theme is around validating the narrative. I won't read the full quote here, but just to identify here, Nancy actually speaks about a client who she believes has experienced racial trauma. So this was a Black man. He was arrested by the police in quite a violent way. And since then, he's developed quite a lot of PTSD symptoms. So for example, he can't go outside in the night now because if he sees the moon, it reminds him of like the torch in his eyes. And the numbers don't lie speaks to the idea that actually when psychologists grounded this within statistics that they were well aware of, it motivated them to understand that this was a real issue that they needed to be concerned with. So theme 3, the system perpetuates racial trauma. So this theme encapsulates the idea that actually the NHS, mental health services and psychologists themselves were not innocent and are not innocent in the perpetuation of racial trauma. So the first sub-theme here, an inherent sense of powerlessness. Isaac says, in terms of ethnicity and race, these are our, and I'm air quoting, hard to reach kind of populations. And, in the borough that I'm in terms of ethnic minority people, Black people are the majority group in terms of the minority group. So it just feels like we don't really have access to those people. So Isaac's kind of speaking to this idea of, we know that this is a problem, but we don't know how to change it. And the second sub-theme here is, we are not innocent as psychologists in the NHS. And Jennifer says, I think that psychologists notoriously sit on the fence. I'm very aware that I have done that in various ways, and I think we need to be more proactive. I think we need to be more vocal. I think we need to be calling a spade and calling out racism. The fourth sub-theme, I'll just skim through here in the interest of time. So theme 4 is same storm, different boats. And this was a very interesting theme as it really highlighted to me the differences between psychologists who were from white backgrounds and psychologists who were from racialized backgrounds. And this idea of actually there were very different experiences. And that's not to dichotomize these experiences, but the disparities were evident. So the first sub-theme here was, I'm a white psychologist navigating my privilege. And this speaks to the idea that for white psychologists, this felt like a new journey that they were going on, where they were relearning. Edith says, one of my clients who's Black British Caribbean, his partner is also Black British Caribbean. She has the same surname as me. I thought about that and I did discuss it with the client because I was concerned that she might think that my family were slave owners and that's how we've got the same name. And the second sub-theme here, I'm a psychologist from a racialised community, and this is nothing new to me. And this is the idea that actually this work is exhausting for psychologists from racialised communities because it's a fight that we've been fighting our whole lives and is personal as well as professional for us. So when he says that's the type of person I was active and doing community activism for a long time. And there have been years where I haven't been doing anything because you just get exhausted and you have to pass the baton on. And it's that extra emotional labor that I'm having to do and I'm willing to do. But depending on some days, my threshold is higher than others. And the last theme that I had is we need meaningful change, not performative change. So turning towards what next. And it was very important to me that this research is not just a thesis for my doctorate. I want this to be research that is taken into action and is used to influence change in the NHS. So I had 3 sub-themes here. The first one, 2020, the year of a racial awakening. Neelam says, why has this just come up now? Why are we talking about it now? What, just because of this incident in America? But this has been going on for generations. Why are we talking about it now? Why is it not something that we've addressed before? What, only now have you come to the realizations about how Black people are treated? But not just Black people, Black minority ethnic groups. I can really sense Neelam's anger here, and I really resonate with that. And it's the idea that was there a racial awakening in 2020? And if so, where was the outrage before? Because this isn't an issue that's only been present for the past year. The second sub-theme here, the revolution will not be televised. This is a nod to Jill Scott Heron's song of the same nature. This idea of actually the change comes from within and the change shouldn't be performative. And that means that when it comes to protests and when it comes to statements that are made, these need to be followed up with real action. And the last sub-theme here, the change needs to be collaborative. So that means that we can't just, as an NHS, as an institution, do this work. This needs to be linking in with local communities. This needs to be linking in with the people who are most affected by this. So those were my main findings from my research. I can actually feel how quite emotional I feel actually looking back. I haven't looked at my themes since handing in. So I think upon reflection, I think it's really, for me, it's been political to do this work, and it is political for me to be a Black woman in the field of clinical psychology. It's not been an easy journey, and it will continue not to be an easy journey. First and foremost, I'm a Black woman, and that has always been the stance that I've taken. But that has meant that I have been labelled the aggressor, and I have been labelled as somebody who is angry. And actually, I am angry. I'm angry about the situation, and I shouldn't have to tone police myself on that. However, I am committed to the cause. I know that this is the reason that I came into this profession, and I really hope that I can continue to do this work. Also, keeping in mind my own emotional well-being and my own experiences of racial trauma. Thank you very much.